Okay, recording and transcription have started. Welcome everybody, nice to see you. Looking forward to discussing health and care apps libraries with you today. Myself and Leslie from the Health Innovation Network in London are pleased to welcome you. If we could make sure all microphones are muted, the videos are turned off during presentation just to preserve bandwidth. Do please drop your name into the chat and your role if possible and organisation. That would be really interesting to see later. And also use the chat function throughout to ask any questions or make any comments. I will send some comms around after with these slides and the recording. I'm going to hand over to Leslie for a bit.
Hi, I'm Leslie Sodan. I'm the Programme Director for the Innovation Theme at the Health Innovation Network, which is the academic health science network for South London. So we just thought it'd be useful just to give a bit of an explanation about AHSNs, and it's always great to work with Kent, Surrey and Sussex. We've worked together previously on a large dermatology programme, so it's great. It's also really useful to do this webinar because what we tend to find is that our stakeholders often come to us asking, what have you got, what digital solution is there around mental health or around MSK? And we often point them towards the Orca platform, but say, actually, it could be really useful for you to do a more tailored digital apps library for your area or for your clinicians, for your stakeholders. So I'm really pleased that we're doing this webinar, and I'm also pleased that there is a platform like Orca, because back when I used to write bids and redesign clinical pathways, we'd always be scratching our heads for an app that was in MSK or neurology or mental health and scratching our heads, and it would have been so great to have a platform like Orca that we could have used. So just a little bit about AHSNs. So we have three strategic objectives: improving the health of patients, both from in healthcare and social care. Also quite unique in that we support companies, and that's part of my role, to drive economic growth, with the objective that if we help increase profit, then that goes back into the treasury. And also looking at efficiencies within health and social care, so around saving money. So just to talk about, we are in the new financial year, but some of our national impacts that happened in 2021. So we did a lot around supporting the COVID, both from a recovery point of view, but also around the at-home model, and also working very closely around setting up the virtual wards, supporting nearly 500,000 patients benefiting from our national programmes, and also from an economic growth point of view. We supported companies to lever in investment, raise investment revenue, and also created 700 new jobs, and 763 jobs were safeguarded, were protected. So overall, the AHSNs, the 15 AHSNs, those are our joint national impacts that we made. And then at a local level, we also run a number of local programmes. So, for example, in South London, we run ones around mental health, diabetes, lipid management, so lowering cholesterol, and also healthy ageing. So I'll pass over to Jill to explain a little bit more.
Thanks, Kat. Pretty much everything Leslie said applies to Kent, Surrey, Sussex Academic Health Science Network as well. We work quite closely together as a network of AHSNs. We also work locally, and we try to be catalysts for innovation. We try to connect partners across sectors, cross-working across organisations, create the right conditions for change, and operate locally, bringing national programmes to a local context and keeping our ear to the ground for local needs that we can then interpret into and translate into innovation as solutions. So we do a lot of fostering and collaborating partnerships across, I know I work across Kent, Surrey, Sussex, so I've seen a lot of names popping up that I recognise, and we're able to share learning across organisations and good practice between projects, respond to local priorities. So we try to stay very close to what those priorities are and respond to the needs of our system partners, and the spread of local innovations as well. We particularly like to hear from clinical innovators and from local innovators, but really we're product agnostic, so we're looking for the best solutions to NHS and social care system problems. So our agenda for today, we're going to hear from Orca on 3 different parts of their system, but they actually have quite a broad range of apps and tools that they can use, such as neurology, respiratory, ENT, maternity, men's and women's health, quite a broad range. So we're just going to hear from a sample today. As I've just mentioned, we are product agnostic as AHSNs, but Orca is a tool that we work with. So we want to work with our local system colleagues just to find the right solutions to their challenges. And then we're also going to hear from 3 peers and colleagues who have used Orca and created their own bespoke libraries in 3 different ways, and the benefits that they've enjoyed from doing that. And then we'll let you know how to take it forward if you are interested in doing so. So we've got some really exciting speakers today. We've got Victoria, Christian and James, who will introduce themselves when they come to their section. We've also got George and Ryan from Orca as well to talk about what Orca have to offer. And if Orca could take over presenting.
Yep, no problem at all. Thank you, Jill. Wonderful. So with regards to Orca itself, just very, very quickly, we are the organisation for the review of care and health applications. We have worked with the NHS for approximately 7 years, around about that particular time, with NHS Digital, NHSX and NHS England. And with regards to the work that we are currently doing, we are working with NHS trusts, CCGs, ICSs, councils and universities to ensure that only the best and the safest applications are available to the actual public. So creating a digital infrastructure, if I may go one slide further on, we go through and look at all the 367,000 health and care apps across the world. As I'm sure you're probably well aware, there are so many apps out there which are not fit for purpose, which are extraordinarily dangerous. We look at specific areas, as you'll see here from the actual slide, with regards to data and privacy, clinical awareness and assurance, security and user experiences. With regards to the actual standards and guidelines that we address, and you'll see from the actual slide itself, and that lists them there, we look at all specific aspects of GDPR, data privacy, data security, clinical awareness, clinical assurance, user experience, functions and features, and a vast number of other areas, such as, for example, medical device regulations and so on and so on. So when we create our specific bespoke libraries for our trusts, for our CCGs, for our ICSs and so on, we can ensure that effectively the digital journey, which I've put some more slides on the actual presentation for you to have a look at after the event, actually is adhered to and is addressed in detail. So here, obviously, a journey in itself to actually look at the transformation program for digital implementation is one where you need to have a look at what you need, how we can address that, how we can give you the activation behind it, how we can give you the assessment behind there, and ensure that your own patients, your own citizens, and so on, have at their fingertips the information they require, the actual applications they require as well, being the best on the market, and not at all those which are not fit for purpose, those which are dangerous, for example. We ensure that they aren't available to the end user. And we ensure that for the areas that Jill has already mentioned, such as, for example, musculoskeletal, mental health, anxiety, diabetes, women's health, men's health, and so on, all the best and all the safest health and care apps are available to not only the community, but also to the clinical community as well. And without further ado, because I know I've only got that much time, I will now pass back to Jill. Thank you, Jill.
Lovely, thanks, George. Okay, so now we're looking forward to hearing from the Digital and Innovations Group at Central and North West London NHS Trust, and somebody else is taking control, so handing over to Victoria.
Hi everyone, I'm Victoria and I'm part of the Digital and Innovations group at CNWL. And CNWL is one of the largest NHS trusts in the UK. So we have nearly 7,000 staff providing healthcare to a third of London's population. And we have more than 300 different health services across 150 sites and in also more community settings too. And so with an organization as large and complex like CNWL, it is not uncommon for teams to just do their own thing. And we have a great deal of exciting innovations underway across the trust. And we have services piloting and using a wide variety of applications. But there is just too much fragmentation where services are seeking out solutions without necessarily exploring the digital technologies that other units within the trust are already using or working on. And so we have identified that there is this need for greater cohesion to avoid duplication of efforts and cost, but also to spread the benefits. And so when we started to work with Orca, we knew that we had this opportunity to address this and seek to provide visibility of all applications that are already being used or explored across the trust and promote the best use of digital. And so what we have done with Orca is that we created this new dedicated space to house and share applications that are being used or are being considered for use across the trust. And so each app has a label clearly indicating its status. So we have those that have been already approved for use in CNWL, some with an in review label, meaning that they are currently being investigated or piloted by a service or services within the trust. And lastly, we have a label received, which are those apps that services expressed an interest in using. And so through this curated CNWL apps library, we're able to provide this much needed visibility to which apps are in use by CNWL, share the learnings and benefits, reduce the costs where possible, and also ensure that our staff utilizes the right apps to help deliver the best possible care. And continuing on with this theme of providing visibility and avoiding duplication of effort, another project where we integrated Orca is the development of an ideas portal. So the ideas platform will provide an opportunity for staff to influence the way things are done at CNWL, and staff will be able to submit ideas, but also share any kind of problems or challenges that they may face. And I think last time I checked, there are about 400,000 digital health apps available to download. So the chances are that there are already existing solutions to a lot of the challenges that our staff may post, or apps that offer similar features to our staff's proposed ideas. And I've heard that someone said NHS are kind of the masters of reinventing the wheel. And what the Orca API allows us to do is to link the challenges and the needs that our staff post on the ideas platform with potential digital applications from the Orca apps library. And the way that the API works is that based on the keywords that the staff enters, the API presents and links to a list of existing app suggestions that may meet their needs from the Orca apps library. And so in this way, we can minimize duplicate submissions and also avoid reinventing the wheel. But also it brings to our attention all these great apps that are already out there and they have been validated by Orca, and therefore they provide that extra stamp of approval and confidence to our staff. And right before I finish, I'd like to end with this really powerful quote that we got from one of our senior practitioners at Milton Keynes Community Mental Health Hub, who's been using Orca Apps Library to complement her therapy session. And she talked about how it adds that extra layer to the out-of-session work. And Orca is still relatively new to our staff. We launched back in January, but we are already hearing this really great positive feedback, which really shows what a valuable resource Orca is. And so now I would like to hand back to Orca.
Thanks, Victoria. Ryan, are you able to pick up control?
I think I'm in control now. Hi, everyone. So my name is Ryan. I'm part of the business development team at Orca. Been in the digital health space for a number of years now, working with several high growth NIA accelerator companies, working in various spaces, both in clinical and patient facing and also workforce as well. So first of all, just wanted to spend a little bit of time just talking a little bit through some of the work that Orca has done around mental health, particularly supporting services like CNWL and other services across the country as well. And I just thought I'd start with some stats really. Over the last few years with the COVID pandemic and other changes in the way we work, there's been an 86% rise in the number of depression apps available. There's been a 76% rise in the number of apps for self-harm prevention. And there's also been a 55% average rise in the number of digital technologies that are available for mental health. Now, part and parcel of my role is also working with the innovator and developer community, sharing some of the ways that Orca can help navigate some of the compliance challenges that are necessary to overcome to gain entry to the NHS, and also working with accelerators and academic health science networks nationally as well. And what we're increasingly seeing is there are so many apps out there that claim to support mental health, mental well-being, that actually finding the right solutions is really challenging. What's more to that as well, because CBT therapy is cited as an evidence-based intervention within the NICE guidelines, a lot of apps now are replicating CBT within a digital format. And what's increasingly becoming apparent is that actually you're creating apps with these evidence-based interventions in, but actually, are they following the evidence base? Are they following the efficacy models and the clinical assurance that is needed to actually use those apps within services? And what we've certainly found through assessing the broad spectrum of applications out there, specifically within the mental health sphere, is that actually less than 30% of mental health technologies meet the quality threshold that we've put together. And this is a 350-point assessment that looks objectively against all of the criteria that's needed, focusing specifically on data privacy, clinical and professional assurance, and also usability and accessibility. So I suppose the real question is, and something that a lot of our customers ask and a lot of our service users ask, is actually how can health systems introduce reliable, safe mental health solutions? And there's lots of different ways that service users, clinicians can find digital solutions, but ultimately they can be synthesized into these two ways. Firstly, individuals may find apps. So someone might self-diagnose that they have some anxiety, depression, they go onto an app store, they find an app that they feel suitable, and they may start tracking their mood, they might start exploring CBT in their own way. But ultimately, how as a clinician or how as an individual can they be assured that that is the right thing for them? Equally as well, professionals are increasingly encouraging service users to use digital interventions. So whether that's something like a Headspace or a mindfulness application, or is referring them to a service or a pay-for service such as SilverCloud, for example. It's really important that clinicians and also service users don't feel like they're shoehorned into one solution just because it forms part of that specific pathway. And actually what happens in these circumstances is that the individual can only trust the developer when they find those applications, because they only can go by what that developer is saying on their website or within the App Store. And also a healthcare professional can only recommend one app at a time, because an organization has only invested in one application, when actually there's lots of really safe, really valid, really valuable applications out there that perhaps are free of charge, that can be integrated within a patient's pathway and ultimately support them to recover quicker and actually feel more empowered as part of that pathway as well. And what we're seeing is increasingly that by using Orca app libraries and formularies on the clinical side, is that we can create those personalized interventions which create greater opportunities for the individual, but also for the health system as well. Obviously, as George mentioned, one of the big things we're about at Orca is about fostering trust, and that's both at the service level, service user level, and at the clinical level as well. And that's why we take so much time in assessing those applications. We want to be able to empower you to introduce apps throughout a patient pathway, right from the point of referral all the way through to discharge and beyond. And also, we want to be able to empower the workforce to be able to access the best technologies, but also see those technologies that they themselves might benefit from. Because we understand that mental health is not a one-way thing. It's not just for service users. And ultimately, the burden of COVID has really impacted the staff that we have today. And some of our customers are directly targeting those staff with mental health interventions as well. We have a number of case studies, obviously a wonderful one presented by Victoria there with CW+, but we're also working with Papyrus for the prevention of youth suicide, the Northern Ireland Health and Wellbeing Library through the HSCNI, and also one of the local partners, Saurian Borders Partnership as well. And I've just included a screenshot of their landing page for their app library. But of course, more than happy to explain more about some of the partners that we're working with to support mental health.
Thanks ever so much, Ryan. So moving on, I wonder if James is able to take control. And if I could remind people to remain on mute, that would be great. Thank you. Over to you, James.
Brilliant. Okay, morning everyone. So my name is James Porter. I'm Director of Major Programmes at CW+, which is a health charity based in Northwest London. But for the purposes of this presentation, I'm also the SRO for a programme which works across the whole of Northwest London called Best for You. So really sort of quick bit on Best for You and what it is. At its core, it's a partnership between the organisations you can see across the bottom of your screen there. So ourselves as a charity, Chelsea and Westminster Hospital NHS Trust as an organisation with the largest, one of the largest A&Es and the largest paediatric A&E in London. Two mental health trusts, one of which you've already heard from, so CNWL, and then West London NHS Trust, and then Imperial College. And it's a programme focusing on young people's mental health and really trying to change and address new models all across the sort of acuity spectrum of that. So really quickly, what are we doing to sort of look at that, and why is digital and Orca so important? So we have two large sort of capital elements to our work. So one is the building of a new young people's centre to provide inpatient care for both mental and physical health patients. The second is a day service. So how do you take some of that inpatient capacity and try and move it out back into the community, but still with that high level of intervention and treatment? And clearly, as part of both of those, having digital offers and solutions that can travel with the patient as they move around the system is really, really key and really, really vital. We then have a big community programme, and that ranges from partnerships with big football clubs, the likes of Chelsea and Fulham, through to partnerships with the likes of YouTube, the BBC, the National Grid for Learning, and other sort of third sector organisations, Just for Kids Law, Maslahah, and lots of others, all working with young people to try and address their mental health and well-being, but not necessarily having the access to NHS resources or tools or that sort of accredited, assured sort of mechanism for getting them. We then have our sort of digital intervention. So our Orca app library sits within a much broader platform, and I'll talk a little bit about why that's so important in a second. And we then have some supporting things which sort of sit around in terms of big volunteering programs, a big research and evaluation portfolio, and then lots of marketing communications. So if we can move on to the next slide, please. So for us, why was the platform so important? So Northwest London is the largest health geography in the country. It's a population of about 2.4 million people, of which just over 500,000 are young people, so under 25s. And of those 500,000, about 37,000 have a diagnosable mental health condition. But clearly there is a whole cohort of people underneath that who are struggling with worries, stresses about school, about coming out of COVID, and about a whole range of things. So we needed something that we could roll out to as many people as possible, but still had that sort of trusted backing, and really a source that people knew they could go to in order to get accredited, trusted information and support. So that was really, really key for us. And why was it so key? So a lot of it came down to the implementation. So as I say, we have a main platform which has lots and lots of information, other interventions on, and that platform is designed in a very specific way, so that it looks a certain way, interacts a certain way, and is very, very different to a lot of other digital resources out there. And we were very, very lucky that Orca could mirror that and match that, so that actually when you transferred from the platform to the apps library, it appeared very seamless. It was very seamless. And therefore, what we didn't get was young people thinking that they were being sort of passed from pillar to post in order to get the support they needed. One of the things we heard loud and clear from them early on was, we want things in one place under one roof where we know we can go to get everything we need. And that integration, both in terms of the sort of seamlessness of transition, but also the visual style, was really, really important. And we're very lucky that Orca can sort of match that for us. Similarly, we're very, very lucky in the sort of support that they've given. You've heard me sort of mention some of the partners. There are a whole load more, all of which want access, all of which want training, all of which want support. And Orca have really been invaluable in supporting us with that onboarding process, from organisations as big as, universities the size of Brunel and Imperial, through to charities with just sort of 20 to 30 employees. Everyone gets the same access, everyone gets the sort of same standard of training. And again, for us, in terms of how we work, that's really, really invaluable. In terms of benefits, so we launched the app library back in July, and then the sort of more formal platform in November. So still relatively early days, but I think some of the early returns that we're seeing are sort of pretty clear. So there's big bits on integrated care and big pieces on, not only the platform, but the apps library really being that thing that sort of brings not only young people's care together, but organisations together. And they, are starting to have conversations that, if one person is prescribed something from the app library and they're moving between organisations, as I say, the app follows with them, and the assurance and the sort of safety of knowing that it's come from somewhere that you recognise and trusted is really, really important in sort of bringing that together. Similarly, for the expansion of the programme, so we are growing and growing quite quickly. So we're always bringing new partners on board, and our hope is that ultimately the programme will sort of expand across the whole of London and the whole of the country. And again, having something that can expand with us and at the rate we want is really, really important. And that's why, again, the apps library is so valuable. Big part of that expansion is having a really strong evidence base and a really strong sort of research and academic base. And again, having the access to the sorts of data which comes out of the back end, which we can then look at, understand in terms of how we change our practice and sort of adapt on the fly, but then also more formally evaluate as part of a process, which then builds the story for how we grow and expand beyond our borders is really, really important. And then finally, just sort of the inequalities and access bit. So people, I'm sure, will know that access to mental health support is not equitable across a whole range of demographics. But again, having something which we can use in partnership with what we're doing is really, really valuable for reaching some of those hard to reach people. And then when we're talking about partnerships with organisations that can help us do some of that outreach, again, having something which has that sort of kite mark guarantee is really, really important in terms of how they then take things up and use it with their young people, which ultimately, when we're talking about the population size that we are, we can't do everything. Therefore, we need to find the right partners and equip those partners with the right tools to do some of this for us. I think that's it from me.
That was fantastic. Thanks ever so much, James. I'm going to hand back over to Orca.
Thanks, Jill. Everyone knows how big of a problem elective care is within the system at the moment, so I don't want to spend too much time labouring that point. We all understand its impact. We all understand the challenges around that. But what we wanted to do at Orca was, in direct response to some of the challenges that we've seen within the system around elective care, some of those pathways that have been most affected by the backlog, we wanted to produce something that gave some direction to different clinical services and also to health systems around what technologies were out there that could bring a real tangible benefit to them in responding to the backlog. And from some of our research, again, we are a very research orientated organisation, and a lot of the work we do is founded on looking at what is out there and what's needed. We know that 93% of healthcare professionals believe that digital interventions can improve a patient's health. And over 65% of patients are now advocates in using digital health to actually support them in their care. But the problem still remains that only 3% of the UK public have ever been recommended a digital health tool by a hospital doctor, a clinician, a support worker in primary care. And really, that's a significant challenge, because what we're seeing is so much investment in digital technologies that do have a tangible benefit and impact on the system. And what we wanted to do for elective care was really synthesize those apps in a way that meant that clinicians could find them to support their pathway specifically. Patients could find them so that they could individually choose solutions to support them while they may be waiting for an appointment, while they may be waiting for a hospital intervention, an operation, and also further beyond that into their rehabilitation as well. So what we did within our elective care toolkit was we did a horizon scan of nearly 300,000 digital health products. We looked at that 350-point Orca baseline review assessment criteria, and we created that portfolio of applications specifically focused on cardiology, dermatology, ophthalmology, and MSK. Can I have the next slide, please, Jill? And the way we segmented the toolkit was looking at these three key areas, and the language is very similar to what's been coming out of NHS England around this approach. And that is looking at those patients who may be waiting well. It's a slightly tenuous phrasing, because arguably patients aren't waiting well. Patients are really impacted by the fact that they can't get in for that hip replacement, that knee replacement, causing mobility issues, maybe longer term mental health issues due to lack of access to leaving the home or without leaving without support. And it's really important that we are able to give applications, or rather health systems able to give applications to patients that can support them while they're waiting for those interventions. Then we move on to prehab and also support for long-term conditions. So actually the prehab involved with making sure a patient is ready for a clinical intervention. So let's say an operation, making sure they're fit for general anaesthetic, making sure that all the necessary information is captured prior to that operation through pre-op assessment. And equally as well, looking at long-term condition management as well. So for a lot of these patients, they're spending less time in front of a clinician, more time looking after themselves, simply because there's so many patients that need looking after now and seen within a service, that actually the need to have solutions that enable that patient to self-care is even more profound. And then equally as well, and most importantly, that rehabilitation. So supporting that initiative around patient-initiated follow-up to make sure that the patient can get access to services when they need them, and also support them post-operation, post-intervention, so that they feel like they've been looked after, they've gone through that pathway, and they can ensure they're in a good place to then continue with any additional care initiatives that may be in their pathway. Next slide, please, Joe. And one of the ways we do this for clinicians is through our digital health formulary. So within the formulary, it's possible that clinicians can search for these apps within the elective care toolkit. They can recommend them to patients, and they have a complete audit trail of which apps have been recommended to which patients, so that they can then trace whether they're being used, whether they're being utilised, and ultimately have that complete risk management profile, so they know that apps that are up to date have been assessed against our standard, are being used by patients, and ultimately, like a medication, if there's any changes to the guidelines, they can remove or suggest the patient stops using that app if need be as well. And the next slide, please, Jill. And one of the things that we're doing with some of the early adopters of our toolkit is actually providing ways that clinicians can even more quickly than through our formulary get those apps to patients to use. And one of the things that we've created is these prescription pads. And it's as simple as being able to pull off a piece of paper. Patients are very familiar with scanning QR codes now. and they can very quickly pick up these apps, see what they feel is suitable for them, and then that clinician also has a log of which apps they're using and also where they're coming from, and in this circumstance, it's from this toolkit. And by no means is the elective toolkit the only toolkit that we're working on. We have aspirations to do something similar for mental health, for primary care, general practice, women's health. And we want to be able to make it as easy as possible for clinicians to be able to find those technologies that are suitable for their pathway, for their patients, and ultimately be able to use them with those patients as well. You can download the elective care toolkit when we send this presentation around after this event. But of course, more than happy to answer any additional questions about that later on as well.
That was fantastic. Thank you ever so much, Ryan. And finally, moving on to Christian, who's joining us from Dorset. Thanks, Christian.
Morning all, my name's Christian Telfer. I'm one of the project managers in digital access to services at home in the Dorset CCG. So our team looks after a lot of the high level digital interventions like blood pressure at home, ACR for digital urinalysis, and the My Health suite of apps to empower citizens and help to keep them out of hospital. The part that I manage is the rollout of the app library for Dorset, and I also coordinate for the other 6 CCGs in the southwest, so helping them with a little bit of the learning that Dorset's got along the way, because we launched just over 2 years ago and most of them have only just launched. So I'd like to talk a little bit about the position Dorset was in prior to launching the app library. So the problem we had was, as we've heard about, the public downloading goodness knows what from the App Store, Google Play. No real oversight or understanding from us of what they were downloading, much less whether it was any good. And in any case, what's the criteria for a good app? Who's got the measuring stick? So it turns out it was Orca. So the solution they provided gave us that chance to put a central resource in place to operate as a safe space. And with that, the opportunity to actually create a kind of digital front door for the public, to usher them in and let them have at it, so to speak, and download lots of safe, effective digital tools, and hopefully begin a journey towards having their health supported by digital. And of course, the pro license piece, which we've heard about the audit trail it gives us. It's just a proper mechanism for professionals to use to recommend something to the public. And that supersedes the much riskier approach we'd seen before that, where it was done just verbally and with no oversight or understanding of whether they were any good and even what was being recommended out there. So next slide, please. So we'll talk a bit now about some of the success we've had in Dorset. So the first success story, I'd term it as proactive care. Our health coaches have done an absolutely unbelievable job at embedding apps in their work. So the health coaches in Live Well Dorset, people can self-refer into them when they've got a lifestyle issue, they want to lose weight, get fitter, or cut down on their drinking and smoking, or maybe they get nudged there by primary care. And the health coaches then sit with them, help them with discussing goals, setting those goals, and then helping them to get motivated, and also giving them the tools to get that journey and make it successful. So one of the key tools that they've embedded is apps. Now that was done by engaging them before this launched and putting them in a position to be successful with the apps. And so it came to pass. They have helped absolutely hundreds of people with app recommendations and with a really good conversion rate as well. So by inserting the app into that, they're basically giving people something to use between sessions and after the relationship with that health coach is over. So they're increasing their chance of success in the future. And we get a little bit preoccupied sometimes with cost reduction. How can we cut costs? I'd probably argue this is one better, actually. This is cost avoidance, because if you're reducing the chances of people having issues with their weight loss and their drinking and the smoking, you're cutting down the risk of them presenting with those major morbidities we associate with those lifestyle risk factors down the line. So making a saving and crucially giving people an improved quality of life and better health. And then we've got the work we've done with the social prescribers. So lots of our social prescribers are using digital, and that really helps them because they're dealing with really varied people in quite difficult situations. They're going out into the community and speaking to people who are dealing with loneliness, isolation, low mood, and all sorts of other issues. And they've proven, social prescribers at a regional and also a national level, adept at getting into and having impact in those spaces that the rest of the system really struggles to get to. So when they go out and they're speaking to somebody with a mental health issue, or they just want to socially activate them, they're able to harness the power of these tools. So somebody who's got mental health, they can recommend one of the clinically assured apps on there. Somebody who they want to activate, they've got a digital tool to add to the analog way, if you like, that they've always had. So they can still obviously say there's this community group here you can go to, but there's digital tools for that now as well. There's social support networks, and there's also things like Tribe Volunteer they can use to actually create a kind of community directory and refer people to the resources they can see on there. So they can say there's a sports group here, a community interest group here. Are you interested? And not only that, they can also give that particular digital tool to the person they're helping. So it becomes a twofold thing. Next slide, please. Now, Leslie said at the beginning of the session that she gets people coming to her and kind of saying, well, you drive innovation. What's the digital solution in MSK? What's the solution in mental health? And Leslie, of course, hasn't got the answer, but she can point them towards Orca. Now, let's look at that at a bit of a higher level. What does that mean for us as commissioners? We're giving the app library to the public. How can it help us? So it's brilliant as a first check when you're looking at trying to find a digital intervention in a particular area. And I'd like to look at a little bit of a case study. So our IAP team, which is the self-referral pathway for mental health, and Ryan was talking a little bit about it earlier, and how there's a lot of kind of pretenders to the cognitive behavioural therapy apps that aren't necessarily following the evidence base. So our IAP team needed a digital intervention to keep people engaged and also give them something to wait well with. So when they self-refer it, they will have the ability to actually take WISA, the full version of it, and that's a really high scoring app on the app library, and they get that, so it gives them something to wait well with, and it also increases the chances of them presenting for that first appointment and finishing the treatment program rather than abandoning it in the interim period. So how did that come about? Let's put ourselves in the shoes of the IAP team doing that commissioning exercise. So we go on Orca and we search for mental health, and we go, brilliant, WISA, 92% overall, looks pretty good. What else do we need? Okay, so the scores are good, and it's a conversational AI chatbot that gives empathy, and it uses cognitive behavioural therapy. Superb. So it sounds like it's consistent with what we're doing, but more importantly than that, does it have relevance to the Roth and Pilling framework, which actually ensures the standard and the consistency of cognitive behavioural therapies? And funnily enough, it does, because it's got 95% for professional assurance. So we're really looking in the right place, and it passes that test. So Orca it's not only saved us a lot of time, it's also pointed us to the right patient tool at the right time. So huge application there. And Orca's really, I think, if we put it in a wider context, it's given us a framework for what good looks like, because prior to the advent of the app library, we didn't really know that. We didn't really have a framework to hold things to. So Orca's not just created that framework, it's also holding different digital products to it by use of the Orca baseline review. And it's putting us in a position where we understand what good looks like. Moreover, it actually gives us a chance to educate the public a bit and say, here is a set of safe tools. Not only that, you can see why. You can look at the breakdown and you can make a really informed decision about what you want to use. So for giving us that understanding and allowing us to put our public in a safe space where we can actually look at what they're doing and learn from them, it's really become a gold standard in terms of our horizon scanning and helping us to give the public safe digital tools. Thank you.
That was fantastic. Thanks ever so much, Christian. And we have rattled through that quicker than I was expecting. So we're at the HSNs. We're pleased to work with numerous Orca apps. We work with Mutu, Wellmind, Lifebox, Card Medic, as Christian mentioned, WISA, a whole raft of tools that sit under Orca's assessment process and under their bespoke libraries as well. And we've got many, many more that are going through the assessment process as we speak. So the libraries are constantly building. We'd be very pleased for you to get in touch if you're in South London or if you're in Kent, Surrey, Sussex. Get in touch with myself or Leslie, and please do take up the invitation from our fantastic speakers to get in touch with them where they've invited you to. And we actually do have some time for some questions. So I did notice a couple of interesting ones in the chat, and particularly on the patient engagement. I've already popped a bit of a response in to say that each of the apps obviously are standalone products, so their patient engagement is individual. But in terms of the apps libraries, I'm going to throw it over to Orca to see what kind of patient engagement they've enjoyed, or to any of our speakers who want to speak on patient engagement.
Sure, if I may go first, it's George here again from Orca. With regards to the actual patient engagement for our libraries, we found that the feedback from the actual patients themselves has been phenomenal. We have got absolutely amazing feedback from specific users saying, obviously, with regards to our time during the COVID lockdown, we had no way of finding out which were the best applications for self-management of specific conditions. You presenting us with this particular library has given us specific information on what we need to do, what we can go ahead and use, and how that can assist us as well. The beauty of what we've got is the fact that when the actual users themselves search for specific conditions, and they find the actual applications behind those conditions, they soon then find that there are sub-conditions that they didn't even know applications existed for. And so what they actually have is the ability of finding not only the actual condition they were looking for self-management on, the actual apps for that, but then they find specific apps such as, for example, load mood swings, yoga, for example, deep breathing, for example, and other specific areas which they would never have used otherwise. So the libraries themselves that we are offering at this moment in time has had some really, really good feedback. So from the Orca perspective, it's very, very good. But perhaps if I could pass over to one of the three speakers, if that's okay.
I can see Christian's got his hand up and James has come onto camera. So Christian and then James.
Sure. So I think the question was probably more about what are the actual apps themselves, so the developers of them doing to engage patients. That varies, I think, across apps, but what I could probably say is the better ones do that. In terms of what we've done locally in Dorset, we've curated a set of products to support the Ageing Well agenda, and done that in partnership with our clinicians. So we've put together a set that are there to support things like bone health, brain health, mental health, physical exercise. And we're not just saying, well, this is great. We've created the set on our app library as a sort of bespoke list, but we are actually putting that to a digital patient engagement group. So we'll get the feedback from them, and if they decide that some of those are actually not up to scratch, then we will be looking for alternatives. So that's a way you can do it in a kind of local way and get that little bit of assurance that your population's going to actually benefit from it.
Brill. James, did you have a comment?
Yeah, well, I mean, I guess 2 points. I'd sort of circle back around to my one on responding to our sort of requests in terms of the look and feel and whatnot of the app library, and clearly you know, a lot of our branding and visual style came from young people and patients. So being able to respond to that and, as I say, sort of match that was really, really key. I think the other thing, you know, and I'm sure this is true across sort of most demographics, is in the digital space, people vote with their feet. So actually having that feedback and the ability to very quickly understand what people are using and what people aren't using, which we can then circle back around into promotion that we're doing, or, you know, sort of live events or whatever, I think is really, really important. And there is a great sort of power, isn't there, in saying, actually, you know, this is our most popular app for anxiety, and we know that because your peers are telling us that with what they're doing. And so I think, you know, having that sort of instant digital feedback, I think, as well, is, you know, really, really important.
That's fab. Thank you ever so much. I also noticed another question in the chat, which was about the timeline for onboarding new fields. And I know you've got quite a big, long list of fields that you cover, clinical fields, but what other ones might you have coming on board at Orca? What's in the pipeline?
Hi, yes, we've actually had a number of conversations with NHS trusts and CCGs recently, where they've been saying the DTAC assessments with regards to the applications is perfect. It gives us everything we really need. But with regards to the 350-point assessments that we currently do, some of the areas that we could have slight improvements on, or if you like, look more detailed review on, is areas to do with technical security and clinical efficacy. So we really are looking constantly at how we are improving those specific areas and working with the organisations to ensure that we cover exactly what is required. James, sorry, not James. Ryan, do you want to perhaps say something on the DTAC assessments potentially?
Yeah, absolutely. I was just going to weigh in. You know, DTAC is increasingly becoming more prevalent. People are there is talk of it becoming more of a mandated standard within health systems now. And one of the things that we're doing with a lot of our customers and partners is really supporting developers through that process and making it as easy as possible for them to get accredited and continue that compliance. But equally as well, on the health system side, be able to provide a trusted framework that they can track that compliance against those apps, make sure that they're only introducing solutions that are benchmarked against that standard. So really, really important in that respect to kind of maintain that security and clinical assurance. But equally, just going back to George's point as well, we work very closely with a lot of the innovation accelerators, bringing these new apps forward, making sure that they adhere to the various compliance and regulatory requirements that they need to access the system. But then also when we're working with health systems, often they will bring apps to us that perhaps we haven't come across just yet, or it's something completely brand new that's been developed in the local area. And we will work with those developers to get them an ORCA baseline review score. So Wiser got 92%. Hopefully they will score strongly. And if they don't perhaps score as strongly as Wiser, we actually provide services to support them in making sure that they can meet that criteria for compliance and also be available within our app libraries as well.
Brilliant, thank you. We've got 5 minutes left. So one last question I noticed in the chat was coming back to James's point around being able to see and assess the data on use. So we've got a question around how can we see the data, not for apps that are clinically prescribed. That's a slightly different thing, but particularly sort of by area or region for those that aren't prescribed. What sort of data are you able to show?
Sorry, with regards to what we actually offer our organisations,
I'd take the question to mean what data. So going back to James's point about people voting with their feet, to be able to see the use of some of the apps.
Yeah, no problem at all. We actually offer on a monthly basis to all our organisations the actual business analytics and business details with regards to who's looking at the actual application libraries, what they are searching for, what particular areas of interest they actually have, what they are then sub-searching for and looking for in that particular area, and then from there what they're actually downloading as well. So we can look at, for example, all the specific conditional areas that people are searching for and looking at. And we can also have a look at not only that, but also what the pro accounts users are recommending to the end users as well. So, for example, we can see which particular applications are being recommended to which individual user, and if that particular user has actually has downloaded that application or not. And we offer those specifics on a monthly basis in a number of dashboards, which then goes through and identifies all those particular fields and builds that into a dashboard element for the individual organisation itself.
Which would support evaluation as well. If anybody were to implement their own bespoke libraries, they would be able to evaluate it based on some of that data as well, which again, the HSNs are really happy to talk through and see what we can do to support. I think that's all we've got time for now. I really thank all of our speakers. Thank you so much for giving up your time to make your slides and come and talk to us today. I can see one last question. Does your dashboard include, in fact, in the last 3 minutes, we'll just read Martin's question. Does your dashboard include deinstalls and stopped using, not just the initial downloads? Particularly pertinent, I think, for mental health, that one as well, noticing that people have maybe dropped out of use. George?
Yeah, we actually go through and identify which particular applications actually have which scores. So we can say This particular mental health application achieves a score of 92%, 82%, 44%, even if you want to have a look at some of those for the actual formularies rather than the actual patient libraries. So we can see straight away where each individual application is at. If it's 65% or above, it meets the actual ORCA accreditation mark, the actual mark of approval, and therefore, obviously, it's therefore available to the end users to download and use. If it's between 65% and 45%, it's amber, and if it's below 45%, it's marked as red. We don't always offer those applications which are below 65% to organisations because they don't want to see any application below that standard. In effect, what we also go ahead and do is say that if you recommend an application to a particular patient for mental health, for example, which reaches a mark of 70% or above, if that particular application, for some specific reason, whether it's iOS or Android or the application itself, actually goes down below the 65% threshold, we can then mark that and recall the information and highlight that information as well at that particular point in time.
Lovely, thank you. And I think it's important to mention that at an individual level, prescribed apps, for example, clinical governance is conversations that would have to be had in the setting up of the apps library to make sure that somebody is overseeing that use and making sure people do complete their treatment. So yeah, let's just draw this to a close. I apologise to any questions that I may have missed in the chat. We will respond to them in follow-up comms. I'm pretty good at multitasking, but I don't doubt that I have missed some. And thank everybody for their time this morning. Good to see you all.
Thank you, Jill. Thank you. Bye-bye.
Thank you. Bye.
Thank you very much.